Director of the Teddybear Clinic, Dr. Shaheda Omar, to weigh in on the incidents of concealment of birth and child abandonment that continue to plague communities across the country, joins us now. Dr. Omar, thank you so much for your time. So, of course, we saw, and as that clip also rightfully pointed out, during the time of hard lockdown due to COVID-19, we saw a spike in child abandonment as well as the physical abuse of young children, quite frankly. I mean, what would you attribute the rise in these incidents?
So we need to look at this from a systemic viewpoint. I think we need to also appreciate and recognize, firstly, the concealment has a lot of, because of, expressing the unwanted pregnancy. Often we find it's teen pregnancies, child pregnant, children that are falling pregnant, and I'm talking of children below the age of 13 years. So there's fear of actually opening up and sharing that. But we also need to attribute the increased incidence of gender-based violence, then the blesser-blessee relationship, but also incidences of rape, and where children have found themselves compromised under the influence of substances, whether it's alcohol and drug, and the lowering the disinhibitions and not realizing the consequences of that. So there are numerous factors that contribute to the increased incidence. And we also need to, when I said systemic, I think we also need to look around at the geographic locations of the high incidence and prevalence of teen pregnancies, child pregnant individuals, because a lot of these areas do not have sufficient recreational facilities, do not have opportunities for children to grow, develop in a healthy way. There aren't enough sports facilities, playgrounds, and opportunities and outlets for children to actually enjoy. I think these are some of the contributing factors that we have to consider. And also understanding that as far as the attitude of society with regard to pregnancies, we're not saying that it's, people need to condone it, but I think just the approaching and the responses that are elicited, but also with going through a pregnancy, we also need to take into consideration the cultural factors where adoption is not an option. The ancestral curses, or believing that the ancestors will curse them should they put the baby out for adoption. That's also another reason that children are abandoned as a result of that.
And I mean, what is also concerning is that very few people actually know that this is actually a crime, for a parent or even a legal guardian or caregiver to desert a child like this, even if they desert this child in a safe space like a home or even fire stations, as an example. There are now calls for the legalization of drop boxes in this country. I mean, what would it mean practically if we had to legalize that route?
Well, what it would certainly mean is that less babies would suffer from these kind of consequences of abandonment, and a lot, the opportunity for thriving, because for every baby that's abandoned, we find that 2 are found dead. So I think one needs to also factor this in, that there is a better opportunity for children to grow and thrive and not be subjected to that kind of brutality. But also what you raised, what very importantly, is the awareness raising and conscientizing of society as a whole, that regardless of whether the baby, the concealment or the death has occurred before, during, or after that, the child or baby has been abandoned, it is illegal. It's a criminal offense, and the individual responsible could be charged and prosecuted or even subjected to a fine or imprisonment. And I think this is something that people need to be more aware of. But the plus side of it is that if there are facilities like this, more and more people will find themselves gravitating to that, ensuring the safety and protection and opportunity for that newborn.
And I mean, also, you know, you raise, of course, the systemic issues around this, and also there could be very much socioeconomic factors at play here. But given the fact that there are alternatives like adoption, I know you mentioned, of course, that there are cultural aspects, you know, for some communities where this might not be an option. But maybe awareness in this regard, in terms of adoption, could play a role?
Indeed, I think adoption on different levels, but one needs to start, you know, already at school. And when I talk about school, we have to start at your junior high, senior primary, because we are dealing with young girls who have just completed this senior primary and come into the junior high school who have already birthed children. And we were even faced with suicides of 4 learners, children, because they could not face this whole you know, pregnancy and the fear of the consequences, the implications thereof. So I completely agree with you. We need to start with prevention, early intervention, and of course intervention where we are creating facilities and opportunities for you know, unwanted pregnancies and opportunities for children to thrive and develop and grow to their fullest extent in a healthy way.
Dr. Omar, thank you so much for your time. Really do appreciate it. Of course, that was Dr. Shaheda Omar from the Teddybear Clinic.